Welcome, everyone, to the Kenya Wanam movement, the KWM podcast. We're really pleased you could join us today.
Yes, welcome.
Today, we're diving deep. We're cutting straight to the heart of a really powerful call to action for Kenya. We'll be unpacking a core document from the Kenya Wanam movement, or KWM as we'll call it.
And that name itself, Wantam Notam, it's Swahili, isn't it? Meaning we are not going back.
Yeah.
Very strong sentiment.
Exactly. And it sets the tone perfectly for the document we're looking at today, which is titled, quite starkly, Kenya is an ICU. The time for action is now W, not tomorrow.
It's definitely a bold statement. It lays out a pretty urgent case about critical sectors in Kenya.
It really does.
Yeah.
And it outlines a vision for, well, immediate citizen-led change. So our mission here today is to pull out the key insights, the urgent messages, and importantly, the practical steps the movement is proposing.
Kind of a shortcut to understanding this whole perspective.
Precisely. And to really get to grips with what the movement is about, we invite you, right from the start, to explore their platform. You can join the Kenya Wanam movement, the KWM, at www.wanamnotam.com.
www.wantamnotam.com. Got it.
Okay, so let's jump right in with that core assertion. Kenya is in ICU. Now, for many listening who follow events in Kenya, this might not sound like, pure hyperbole. What's the central problem being highlighted, especially when it talks about the health system?
Well, what's really striking is how direct it is. The document doesn't frame this as some future problem, something down the road. It calls it a profound crisis happening today.
Right now.
Exactly. It states pretty unequivocally that Kenya's health system is in critical condition. It paints this picture, hospitals just overwhelmed, clinics severely underfunded, and patients are suffering immensely.
And it uses strong language, calling the system broken.
Yes, broken.
Yeah.
And it specifically points out that the politicians, those in charge, have effectively turned a blind eye to this whole situation. It's a direct accusation of neglect.
Okay, so health is clearly a major focus, a critical area. But the source seems to paint a broader picture of suffering, doesn't it? It's not just hospitals.
Absolutely not. I mean, while health is definitely front and center, the document highlights a much wider societal crisis. It talks vividly about children without textbooks in schools. Think about that. No basic tools for education.
A whole generation affected.
Precisely. And it mentions farmers struggling, operating without the support they need. And crucially, it emphasizes that essential workers, doctors, nurses, teachers, they're just waiting for support that isn't materializing.
So it suggests a systemic failure, really. It's all interconnected.
That seems to be the core argument, yes. A deep interconnected crisis across vital sectors.
And this leads to that really powerful line, waiting for tomorrow is not an option. What does the document say will happen? What are the consequences if action isn't taken, right now?
Yeah, that's the critical question it poses. What happens if we wait? And the answer it gives is, well, it's stark. It just says nothing. Nothing will change for the better and worse. It says, every day you wait, lives are being lost. It uses this incredibly grim image of ghost hospitals.
Ghost hospitals, what does that mean exactly?
Buildings that should be places of healing, but they're effectively empty shells. Maybe lacking staff, maybe equipment, maybe both. Just standing there, monuments to failure, unable to offer the hope or care they should.
Wow. That really drives home the human cost. It's not abstract.
Not at all. The message is crystal clear. The crisis is today. It's happening now. It can't be pushed off to 2027 or the next election cycle. The urgency isn't just talk. It's framed as, quite literally, a matter of life and death for many.
Okay, so the diagnosis is dire. Kenya in ICU, multiple sectors failing, lives being lost daily. The document then pivots, doesn't it? It starts pointing fingers, assigning responsibility for this state of affairs. Who does it single out? It mentions the elites.
Yes, it does. Broadening it out, the source places the blame squarely on a failure of leadership. It states very directly that the government has failed to serve the people.
Failed to serve the people. Strong words.
Very. And it highlights what it sees as a shocking disconnect. It talks about Kenya's elites build churches worth billions of shillings, while basic things like healthcare, education, support for farmers go critically underfunded.
That's a really sharp contrast. It even gives a figure, right? A 1.2 billion Kenya shillings church versus underfunded hospitals.
It does. And the document presents this disparity almost as self-evident proof of misplaced priorities. It argues that those in power seem to prioritize their own wealth and power above the fundamental health and well-being of ordinary citizens or the livelihoods of the nation's
But
farmers.
the argument is, if they can fund that, they can fund essential services.
Exactly. That's the core logic presented. If the elites can afford, as the source puts it, lavish projects, including that billion-shilling church, and also luxury homes, private jets, and foreign vacations, then they absolutely can invest in critical public services.
Things like,
Well, proper funding for healthcare, ensuring hospitals have what they need, making sure schools are properly equipped, and importantly, providing fair wages for those essential workers we mentioned, doctors, nurses, teachers.
so it's really a call to rethink resource allocation, to
Yeah.
question society's priorities.
Precisely. It encourages you, the listener, the citizen, to think critically about where the money is going and where it should be going.
Okay, problem identified, accountability assigned. What about the solution? The KWM doesn't just diagnose, it prescribes action. And it seems to put a lot of power, a lot of emphasis back onto the individual. It says you are the key to change. How does that work?
Well, this is where the document pivots again, this time towards empowerment. It's quite striking because it essentially bypasses waiting for politicians or institutions. It tells individuals you don't have to wait for someone else.
So what should individuals do?
It proposes a very direct approach. Step up and expose the corruption that it argues has been allowed to thrive in communities, often unchecked. It's about taking immediate personal ownership.
Taking ownership. Okay, but how? Does it give practical steps? It's one thing to say expose corruption, another to actually do it.
Yes, and this is where the movement strategy becomes really tangible. They propose using their platform, www.wantemnotem.com. It's described as much more than just a website.
A tool.
Exactly. A tool designed to help people uncover the rot in your community. And it outlines these very practical grassroots methods. For instance, forming small groups, maybe just 5 people to start.
Small manageable groups. Okay.
Then these groups are encouraged to connect with local journalists, local reporters. And crucially, use the technology. Everyone has their phones. Use your phone to document what's actually happening on the ground.
Documenting what specifically?
Things like those ghost projects we talked about. Projects where taxpayer money seems to have vanished, leaving behind, say, an unfinished clinic, or a school building that's just a shell, or documenting the reality of empty hospitals or school buildings in disrepair.
So capturing visual evidence.
Precisely. Take photos, take videos, gather the evidence, and then post those photos online and let the truth be seen. Share it widely.
The idea being that sunlight is the best disinfectant.
That seems to be the underlying belief, yes, that every county matters and every instance of corruption or failed service needs to be brought out into the open. Make it visible, make it undeniable.
And this is where, as the listener, your involvement really becomes central to the KWM's vision, isn't it? The movement is saying the power lies with individuals taking these concrete steps.
That's the core message of empowerment here.
So that digital hub, again, www.wantemnotam.com, is presented as the place to coordinate this, to share what you find. The call is clear. Visit www.wantemnotam.com, create your account, and start sharing your observations, your evidence, your ideas. Ideas that can help change your village, your city, your entire nation.
It's a call for active participation, definitely.
Okay, moving forward to the document, it declares, the time for excuses is over. Business as usual must end. Again, very strong language. How does the KWM actually envision this shift away from business as usual? What's the end goal?
Well, looking at the bigger picture here, the movement seems to be aiming for a fundamental shift in how resources are used and what gets prioritized. The argument, as we touched on, is that if leaders can afford immense personal luxuries, the jets, the mansions, the vacations, then those resources can and should be redirected.
Redirected toward.
Towards the public good. The ultimate goal is making sure schools are properly equipped for learning, that hospitals are staffed and stocked to save lives, and that public servants, the people doing the essential work, are paid fairly and treated with respect. It's about a complete reorientation towards collective well-being.
A fundamental change in priorities. And the document uses that incredibly visceral language, calling this not just a call to action, it's an emergency. It's a matter of life and death. What does that intensity tell us about the KWM's conviction? It goes beyond just policy, right?
Absolutely. It really brings us back to that human cost. The source explicitly points to the poor, the sick, the underpaid teachers, the struggling farmers. These are the people, it argues, who are suffering directly from the current state of affairs.
And they can't afford to wait.
Exactly. It stresses they don't have time to wait for the next election. The document presents this almost apocalyptic warning. The future of Kenya itself depends on people taking immediate action now to rise up, expose the corruption, and demand the services you deserve.
So it's framing inaction not just as undesirable, but as potentially catastrophic for the nation's future and for individuals right now.
That's the weight of the message, yes. It highlights the concrete, daily struggles, framing this as an immediate survival issue for a large part of the population.
And it's not just about healthcare or corruption and isolation, is it? The source suggests the KWM is engaged in a broader set of what it calls fights.
That's right. If you look at the KWM website, which the source points to, it outlines several key areas. It's quite comprehensive.
Like what?
Well, there's the fight against ignorance, which focuses on education, the fight against disease, covering health and wellness, which we've discussed a lot. Then there's the fight against impunity, which is about demanding accountable leadership.
Holding leaders responsible.
Yes. And finally, the fight against poverty, focusing on economics, on lifting people up economically. So it's not a single issue movement.
No, it suggests a really holistic strategy, tackling multiple interconnected challenges facing the country.
A comprehensive approach to national transformation, it seems.
So, wrapping things up, the message from the KWM, echoing throughout this document, is incredibly consistent, isn't it? No more waiting, no more excuses. The time for action is now.
Unmistakably clear.
And the power to actually change the narrative, as this source highlights again and again, rests with you, the listener, the citizen. It rests with taking that first step.
And you know, this whole deep dive into the Kenya Wantam Notam movement's perspective, it really challenges us, doesn't it? It makes us think not just about what needs to change, which is often debated, but more profoundly about who actually holds the power to kickstart that change.
That's a great point.
And it leaves us, perhaps you listening right now, with a powerful question to consider. In your own community, wherever you are, what ghost projects, what examples of neglect or unaddressed needs are just waiting for someone, maybe even you, to bring them out into the light?
A very potent thought to end on. And if you want to learn more, if you feel moved to become part of this movement that's calling for such immediate change, the place to go is www.wantamnotam.com.
www.wantamnotam.com.
Create your account there, start sharing your ideas, your evidence, anything that you think can help change your village, your city, and ultimately the nation. Thank you so much for tuning in and listening to the Kenya Wantam Notam Movement KWM podcast.
Thank you for listening.